Hello, my name is Pam Hall, and I am the coordinator of the Respiratory Therapy program at Conestoga College. I wanted to take a moment to welcome you and also to thank you for taking the time to explore what I feel is an amazing field of practice, and that is respiratory therapy. One thing that I have found through the course of my career is that unless you have had dealings with a respiratory therapist in your life or with maybe a loved one, if you've had some breathing difficulties, many people don't really know what a respiratory therapist does or who we are. So, a common misconception is that we are a branch of nursing, and that is not the case. We are a unique healthcare profession. We certainly work alongside nursing, as well as physicians, physiotherapy, occupational therapy, social work, etc. Most of our respiratory therapists will be working in a hospital setting, however, not all. And so we'll touch today on some of our alternate roles away from hospitals. What is a must in our field are things like critical thinking, the ability to work in a fast-paced environment and really think on your feet, the ability to assess patients and situations and make decisions quickly, and the ability to communicate effectively with the team. Those are all things that we look for with respiratory therapy. So let's highlight some of the roles of the respiratory therapist. Like I mentioned, many of our grads will graduate and find work in a hospital setting. A lot of that work is in critical care, emergency care. This is one of very few professions where entry to practice is critical care. So you're well trained during your clinical year to adapt to and be able to take on those roles when you graduate. Uh, some of the things that you might see a respiratory therapist doing, certainly airway management. So placing endotracheal tubes or airway adjuncts as needed if patients are having difficulty with their airway. Life support, when you hear of people being on life support, they're usually on a ventilator and a respiratory therapist would be taking care of that equipment. We are involved with cardiopulmonary resuscitation. We're on most, if not all, Code Blue teams. And we do things like transport patients and go to high-risk neonatal deliveries as well. So our patient population really does range between adult patients, pediatrics or children, and neonates or infants. We have some other responsibilities, and this is not an exhaustive list by any means, but we do deliver inhaled medications. An example might be something like Ventolin, which some of you have heard of, I'm sure. We also can deliver oxygen therapy and titrate that oxygen either up or down, giving a patient more or less oxygen to keep their blood oxygen levels at a normal range. We also have a role in the operating room as we assist anesthesia. The role in there is also very technical. However, just so that you know, there is a post-grad opportunity, something called an anesthesia assistant that you could move into after graduation and after you've worked for a little bit of time, where you have an expanded role in the operating room as well. We are involved with hyperbaric oxygen therapy at some hospitals. Just to give you an idea of some other areas of practice for respiratory therapists, certainly we have a big role, and that role is definitely increasing in community care. So we have more and more patients that have been discharged from hospital and go home on oxygen, go home with an advanced airway like a tracheostomy, or maybe even home on a ventilator. So they would be followed by a respiratory therapist there. We are also involved in different clinics, so asthma and COPD clinics, where we can provide some education and support for those patients. Various diagnostic clinics, examples might be sleep labs or polysomnography clinics, pulmonary function clinics, and others as well. Respiratory therapists find roles in education as well as research and in medical sales. So what does the education look like for respiratory therapy? Respiratory therapy is a 3-year advanced diploma. So if you're thinking about going into respiratory therapy, you may want to consider the pre-health pathway for advanced diplomas and degrees. Respiratory therapists after graduation have to pass a national exam, and when they do, they become registered respiratory therapists. We are also a regulated health profession, and we have a college here in Ontario, and that is the College of Respiratory Therapists of Ontario. This is a busy slide, I know, but this is from our website, and this highlights admission requirements for RT. So you can see that, things like English and math are a must, chemistry and biology. Physics is as well. So you will have to have a physics background in order to get into and qualify for admission into the RT program. Now, the admission average as it stands for fall 2021 is an average of 85, but that doesn't necessarily mean that you will be admitted into the program. What that means is you will be invited into our supplemental process, which I will talk about in the next slide. But just another thing to note is that if you are coming from pre-health, or you have an advanced level OAC, U or UC level from high school or university, you will get some additional marks on your grades to help you achieve the admission requirement of 85%. As I mentioned, respiratory therapy is a 3-year advanced diploma. But at Conestoga College, we actually condensed that program into 2.5 years. So what that means is that at Conestoga, we graduate our students in December, which makes them eligible to write their registry exam in January. All other programs in Canada graduate in April or May and write their registry in July. So the RT program at Conestoga gets our graduates out a few months earlier and gets them in the job market a little bit earlier. So that's a real benefit. We take 42 students in our first year, and we generally have more than 350 applicants, sometimes almost 400 applicants a year. So it's very competitive. If you meet the 85% grade average, you will then get invited into our supplemental application process. So with the supplemental application, there are 2 parts. One is a digital portfolio where you will highlight for us different things that you've done in your life, some volunteer work, leadership activities, any sort of certifications or awards, anything that might be relevant to this field of practice, or can paint a picture for us of that well-rounded RT, which is what we're looking for. We also ask for a video submission too. Now, the details of all of these are given to you with a lot of detail when you're invited into that process. So don't worry just yet. When you're invited in, you will get more direction. I've added a few links for you today in my presentation so that you can see for yourself what our facilities have to offer. Please take some time and have a look at Dune Campus and more specifically the RT lab, what we call our integrated practice lab, and our simulation suite. In case what we've talked about today has piqued your interest, here are a few additional links for you to explore respiratory therapy further. I wanted to thank you for your time, and I wish you all the best of luck in the future as you explore different professions and make your decisions. Take care.